This presentation really covers a social, racial justice frame as well as environmental justice. And I try to describe our application as an organization approach to applications, policy efforts, grassroots initiatives, and decision making, right? Because we sit in the community and we also sit at the decision making table. So our mission at Environmental Health Watch, we work on healthy homes, which is like core to us. We've been around for 40 years. I've been here 20 years and I've been a director for 5. So healthy homes is like the core of what we do. Intersectionality and intersecting concepts is really what we try to do as our culture of the organization, collaboration. We also are technical, so we can actually identify problems in the home and also remove hazards, toxics in the home. Indoor air quality is what we focus on, right? Sometimes people see environmental organization and think that we do everything. No, we do not. So our focus is healthy homes, indoor air quality, mitigating hazards, and under the sustainable communities, which I'll talk a little bit more about. It's more of a responsive exchange in community, and I developed that program to really feature and highlight environmental justice and now health equity, but it's also a very engaging process under our sustainable communities. And it's more about like the environmental stewardship concept as well. And we also dig into policy advocacy too. So these are the things we do and provide. And our research is also a reason why we have expertise, and we always have a direct service component, even with research. So what makes our organization unique as an environmental justice organization is that we have our foot in the community, right? We do research, we can train, right? And we advocate, right? So we just don't advocate, but we also have a connection to people, and working directly with people also informs our advocacy approach, because we get to hear and listen to people's concerns on a regular basis, or we're very intentional about hearing and listening to people's concerns as it relates to advocacy and our approach to advocacy. So this is just a list of all of the different research and technical studies we've done. I've been a part of mostly all of these or some component of it. And so today, since we are talking about climate change, I will hit a little bit on the Deep Green and Healthy project, because we work in housing, food, in those spaces in relation to how it might impact climate change. But the research is a technical component of the work, but we also have a grassroots component of how we address climate change in that way. And it's not really like out front. It's not that we talk about climate change all the time, but what we do impacts it, and also educating people how they impact the environment. And so we also focus on moderate and low level mitigations. So we know that affordability is an issue for a lot of folks. So the approaches we take are kind of low level, low cost, moderate cost interventions that can be applied to create healthier homes in our communities and more sustainable communities. So because we are a small nonprofit, we still have a lot of capacity to apply and execute, but we do it collaboratively. The only way we get all this work done, and we've done a lot of work, is we partner, we have collaborations, and our residents and our communities are also looked at as our partners, right? We learn from them, they learn from us. So with that expertise and understanding, we build the proper teams that could impact the program or project or research or whatever, and we work together in a multi-sector environment. And a lot of times I'm leading the teams, and I build the teams because I get to understand and build relationships. So then we do have these successful outcomes. So before we talk about the technical or the program application, I always try to really talk about the history of communities, and the community is talking a lot about now redlining history and race, and how race informs our decision making, and really thinking about race now and not putting it to the side. And so I'm part of a team called Centers for Achieving Equity that used to be called the Cuyahoga County Place Matters team. It's like a think tank. We write reports, and we are really just starting to form and elevate who we are. But this report was done at least, what, 4 years ago. And so we really started to look at values, policy, decision making that was sanctioned by our government or supported by our city planning, right? So this is where the red lining map is for Cleveland, and you see the red indicates where people of color were pushed to move, and then they have this yellow, blue, green. Green is kind of where they put white people. They felt like those communities were safe. And the yellows were, you need to be cautious if you move there. So this impacted real estate, it impacted banking, it impacts us now, even though this was in 1937. And that's where people need to connect the dots. If somebody is a teenager, they still get this same presentation. I don't leave this out of the conversation just because people are younger, because they're leaders too. And I like to have them understand system change, policy, and bring the data to everyone, right? So I'm just gonna show you after this slide, like a series of maps. If you remember the slide I just showed you and the outline, and then apply it to the other maps I'm gonna show you. And I also wanna bring in some definitions, right? Because I think that we all have our own understandings of things, or define things how we see them, or from a perspective versus understand the actual definition. So in the report, we do talk about the historical policies and how they have long-term impacts, and kind of map out where those impacts affect us today, and in which neighborhoods and who. And honestly, a lot of the city and a lot of the people and communities are impacted by multiple issues and multiple factors. And we don't have to solve everything, but we have to understand that people are experiencing these things intersectionally, right, in their daily lives, and it's compounded a lot of times. So I talk about internalized racism, interpersonal, institutionalized racism, and structural racism, because some folks don't understand the difference. Or if we as people of color, for example, internalize racism, then we might act differently towards white people, and also want to be more accommodating, for example, because we don't value who we are, because we've been told by the society that we are not valuable. And so we can internalize that, or consider the color of my skin. I'm a dark-skinned woman, and there's a lot of times women who are darker have some issues because of the skin color, because we're told white or light is better. Those are examples of how people perceive themselves based on this society. And so when we talk about structural racism, sometimes it's hard for people to get their heads wrapped around the approaches and applications to deal with a structural situation. And so that's where we've been, and I've evolved to really start to understand, how do we look at the structural situation across our city, and then how do we look at policies and programming or approaches that hit the structural part or the institutional part, right? And not base it on just the interpersonal exchange between two people. Of course, it's great to have that and learn about each other, but if we're not dealing with systems and structures, it's not going to impact the community at scale. And so we know about disinvestment because we see it now. We see substandard housing issues in our community. We understand environmental contamination. And now I need to change the food deserts to food apartheid. My colleagues across the country who are experts say we should say food apartheid, because it's an intentional, systematic thing that's happening, right? And that this communities are not deserts. There are people there, things are live there. It's not just what we call barren or something like that. So we got to be concerned about the words we use and how we talk about people in their communities and the narratives that are out there. So all of these things are related to disinvestment, right? But let's not get overwhelmed because there's ways we can problem solve. So now that we looking at this, I think across the country, well, I know across the country, public health folks, policymakers are starting to label social determinants of health, right? And to me, it's just another way to talk about all the impacts, all the things that plague our society, and now we're putting some frame around it. Social determinants of health is a way to say all of this disparity is associated with environment, stress, racism, calling out racism, violence, discrimination, food insecurity, right? So all of these things are what we call social determinants of health, which give us poor health outcomes. If we're dying, right, slow deaths because of all these things that are at the root of the situation, how do we start really looking at the root cause? Because we have a very programmatic approach in the past, or we blame the victim, expect everyone to be responsible for their own health when the environment is not conducive to them having access to food or having an ability to walk their communities because of the violent situation and so on and so on. But if we are more intentional about our approaches, then we can start to solve some of these things and think about the impact, that we can address a few situations or consider transportation when we're talking about food access. If I can't get to it because I don't have transportation, then how do we start the problem solve for a few factors? And so I think that we really need to start to bring in folks who have a lived experience, right? Instead of talking about folks like statistics, data, but we need to have conversations with people who are dealing with this or impacted, and also folks who have a lived experience, to me, are just as or more important than someone with letters or PhD. We do need the academia because it helps us frame, inform, and focus on where we put our resources, of course. But the lived experience, the people who are impacted must be part of the decision-making process and part of the planning and execution, not just called upon to justify our decisions we already made and then say, hey, how you like these pictures? Are you good with this? Yes, and we check the box and call that engagement. That's a meeting, right? That's not a one-off thing. It's not really community building. It's not relationship building, and it's not involving those impacted in decision making, right? Because we can think we know the answer, but until we sit down and listen and build real partnerships, they have the answers to their problems. The people in the communities can problem solve. A lot of times they need us as organizations to support and partner and bring resources. So some of you seen this already. It's related to social determinants of health and how long you live. Your zip code dictating your life expectancy. This is where people of color live in the city of Cleveland. This is not that clear, but it really tries to show food access in the communities and who has access and who lives in within a food apartheid situation. I was relating this slide from 2004 to folks now based on the lead poisoning rates at that time of children who were confined with a lead level in 2004. It's 2020 now. And not to get too technical, but lead impacts the ability to read. It impacts the IQ. It can is related to people having ADHD, school dropouts, violent behavior, right? It's related to things. It's not the sole cause, but it impacts folks. It could impact folks severely through a lifetime. So I show this map to show this is the community in 2004. Although we always have initiatives to deal with this issue, but it hasn't been very systematic. So this is our situation in Cleveland 2004. This is the census tract data in Cleveland from 2016. You still see the hotspots. So we've moved, and remember, these are only confirmed tests of children who actually get poisoned, who actually get tested, I mean. So if you're not getting tested, there's a whole slew of children who are not getting tested because our testing rates aren't that great. But lead poison is something we can prevent and do something about because we have decades of research. This is 2018. It looks better, right? But once again, who's getting tested and confirmed? And then we still have this one hotspot, but I really don't want people to get confused and think we totally solved the problem, but we are almost there. I think with the new initiative that I'm gonna talk about later, we can actually, hopefully, make this whole map green and also get more people, more children tested. So this is just an environmental justice hotspot map. So what is environmental justice? I always like to hone in on the fact that environmental justice for me is including people in the decision-making process and what happens in their communities. Environmental justice is not just about air quality, poor polluters, which I think a lot of people go to that frame about environmental justice and forget about all the other meaningful involvement language that includes environmental justice and the approach and how we look at environmental justice. So I've evolved from being developing programs, trying things, and I'm always trying new things. Nobody, I think, has the solution and a total answer, but willingness to do something different, willingness to engage a different way, right? So now we want to talk about how we connect program to policy, how we connect the people with the lived experience to decision making in real ways, and have involved in how policies are changed. And policies are not only legislation, but it could be the way a company changes, or who's on people's boards in some of these nonprofits, and how are we really thinking about equity internally and externally. So policy could mean a lot of things, and systems change could include a comprehensive strategy. Through the health department, stuff I've done that didn't need legislation, it needed the building and housing or the health department to think differently about the approach and what they actually could implement. So I started to build the sustainability program in around 2007, 8 to 12, because on the bottom left is an actual meeting called Entrepreneurs for Sustainability that I had started attending just because I wanted to find out what's going on in the community. And as you could see, pretty much it was like all white people. There weren't people of color attending. I also was able to participate in a Bioneers conference. And so I looked around the table and they really wanted more people of color at the conference. So I went about talking about, well, if you approach it with these programs or these opportunities, it's not resonating with people of color, you need to change the program in the conference and to have people want to participate. So I did that and we started to work together. Then I started to go, I got some dollars and money to go into neighborhoods of color and ask the question, like, what does sustainability mean to you? Do you consider, what do you think when you hear environment or environmentalism? What does that look like to you? How do you define it? And Dr. Rhonda Williams from Case Western, my professor, she in 2002, 2001, I graduated, but she would talk about ask the right question. So that's what I started to do. We developed a lot of programs based on a community action plan. On the left, you have a backyard garden project that we did with Ridall Farm. On the right, there's a deep energy retrofit picture of a research project we did in communities in Cleveland. So how we look at right now, I'm still developing, but our housing, food, and education is kind of how we worked on climate change through the Deep Green and Healthy project, which we were able to reduce energy use by 77%. We did easy dozen cooking classes in public housing in communities of color. We did several rounds of that, which was promoting a plant-based diet, local foods, and cutting out beef and dairy, which could have a climate impact and a lifestyle change for folks. Because remember, a lot of people that came to those classes were dealing with health issues and didn't know what to do. It's not enough to tell people, oh, get some vegetables or go grow a garden. At that time, that was the narrative. Oh, just grow a garden or get a community garden, right? But then it's like, well, what do we do with these vegetables? And I live by Save-A-Lot or I live by Aldi's. I could still be healthy and shop the perimeter because I don't have a Whole Foods in my neighborhood, right? So these are the concepts we took with Bill Scott and created something that would try to address those issues. And then environmental stewardship, we work with youth, we work with youth leaders. We start to talk about technical, how to teach people to compost and garden. What is climate change? We do an education approach at first, and then we do an exchange and solution focused approaches in these community meetings that I did over a year from 2011 to 2012. We also look at air sealing, weatherization, do it yourself, trying to reduce energy use in a lot of different ways, giving people options. I think a lot of times we talk about climate change and the technical aspects, we don't give folks real options. We just talk about things on a high level. It, doesn't really resonate. And I talked to you about the backyard garden. It still was a local foods. What do you want to grow? You can go right in the backyard, grow it, eat it. It's affordable and you can compost and stuff like that. So this is a few of our projects. These are logos and stuff. I try to brand what we do. But at that time, like I said, I was just trying out a lot of programs. Now I take what I learned and try to apply them on a larger scale. So I've done some national projects. On the left side is Fresh Low and Fresh Local Equity, a youth focused program, and the Build Health Challenge, which is a national project. And then we executed these models and new models of doing business and approaching it with an health equity framing, right? Environmental justice framing. And now, most recently, we had a Lead Safe Cleveland Coalition, and I am the administrator for the new Lead Safe Resource Center. So taking these values, principles, equity approaches, and actually applying them into a real place you can touch, like the operations within the resource center, where our community leaders are at the core of that work, right? And it's based on a policy that was passed as well. It's a lot to say, and I know a lot of times I want to give folks time to talk and ask questions. So I thought this is important because the focus of the One Garden Valley, which was named by people in the community, and the table was set with artists, with youth, with folks in Garden Valley, naming Garden Valley because people want to rename neighborhoods, right? And Garden Valley is a cultural piece to the community, and people are proud of where they came from, right? Even though it's a low-income neighborhood, people talk about this community all the time. They have a very negative narrative. We want to shift that. So we dug in, getting funded nationally from Kresge Foundation, and did this curriculum development based on hip hop, ownership, understanding business concepts, but we knew a lot of people in the community, a lot of youth in the community were focused on music. So we took that as a cultural aspect, food, arts, and culture, right? And just started to build a whole program and curriculum around that. And at the basis, it was entrepreneurship and leadership, not so much the technical, but understanding owning something, owning your art, and then how to monetize it. So our entrepreneurship model values equity and community participation. So equity is iterative, right? We also evaluate what's going on with the team, what's going on with the program, right? So you always got to look at your internal operations to say, is this fair? People feel comfortable. And when things came up, I had to address it because we want to keep equity at the center. So this is just a list of a lot of stuff we were able to do in 2 years, and evolved and elevated the culture and arts piece in a community that we were told people wouldn't come out. People don't come out after 7, you know, it's a lot of stuff. The radio show is still happening, right? We actually had an open mic that's now transferred over to a resident that lives there. So we kind of evolve the work and try to create a sustainable factor, a sustainable piece to it. And this is just some of the pictures that everybody participated, from the police to the youth, and Cleveland, Rachel DeSille also participated, had her youth photographers come out. We had a lot of press. And this was our first try in regards to having a kind of a fun in the community, and not a social service aspect, with more entrepreneurship, fun, culture, and arts. So now we were able to build a platform called Fresh Fest Cleveland, which had like 6,000 people come to the Ridolph Farm in Garden Valley. We had national artists come. We had people from all over the state come to this place that people say no one would come to, right? Nothing bad happened, right? So now we can create a destination place, and people that live across the street can have access to something like this, and they don't have to go other places to enjoy a festival. And the entrepreneurs, the vendors sold out of food, and so the people that live in the neighborhood didn't have to pay a fee to vend, because a lot of festivals, they charge a lot of money, and so it cuts access. So we have this also platform using technology, putting more power in the tenant's hands. They can look up a house and add the address in there and see if there's violations, or if if they live in a house, they can see if the landlord is registered or not, and if there's code violation, or if it's foreclosed on. So this is just another piece of learning from the community, applying it, and now we have a product at scale that anybody can use. Lead poisoning is a big issue in Cleveland. It's been an issue for decades. So attention started to be called to the issue. We've been in the news. Now we got to understand the issue in Cleveland. I showed you the map. We are worse than Flint, but because Flint happened, the articles happened. Al Jazeera came to Cleveland. The New York Times came to Cleveland. The RNC came to Cleveland. So all this was happening around the same time, which put us kind of again in a space where we could start to look at the issue. But with the Cleveland.com, they didn't stop pursuing it until we got to this place. And now we have a law for lead safe for landlords that have to show their home is lead safe. And the law was passed in 2019. We had 500 people come to a summit from all over the county to participate. And we have leadership teams, right? Leadership at the core. We did a lot of work together and dug in, and now they're still working with us. They're here now putting plans together for Lead Week. So also defining what are we trying to accomplish? Health equity, what does it mean? What is it? It's still about fairness. It's about access, it's about quality of life. I think we put new names and new levels on social justice concepts, but it's also a way for people to dissect it, I guess, if we say it nicer. And what the system change look like. Perspective transformation was a definition that was brought to me several years ago, and I think it's a great way to define what we think it looks like, because systems change. People sometimes don't understand what that looks like, but it's transformative, right? How do we see things different to do things different, right? A lot of times people might be stuck in bureaucracy or what they can't do, versus saying, well, let's really be intentional to see what we can do. Let's first understand the root cause. So when we come up with solutions, we actually are tackling the issue and not putting a Band-Aid over it. So I like this slide because previously we had these slides that showed the big barrier, right? But what if we just get rid of the barrier? I think we can save on resources. We can actually make a difference. And then we thinking differently in a different way that we might be dealing with a problem, instead of continue trying to work around the problem, can we remove it and do something different so that everybody has a fair chance, an equitable chance of thriving and succeeding and building together. So that's my presentation.